Good evening everyone. This is Jasila Mujib welcoming you to a brand new episode of BMC Global Live Al-Hilal Health World Nothing But Lifestyle. Your health is our concern, so we bring before you an efficient doctor and a relevant topic in each episode. Today's episode, the topic is uterine fibroids and their treatment. We are very fortunate to have Dr.Brahma Lakshmy. She is a specialist in obstetrics and gynecology at Alhilal Hospital, Muharraq. She has an experience of 8 years and is specialized in laparoscopy surgery. Hello doctor, welcome to the show. Doctor, our topic is uterine fibroids. Today it's a matter of concern for many women about the uterine fibroids. Can you explain what are uterine fibroids for our viewers?
Uterine fibroids are very common benign tumors. When I say a tumor and benign means it's not cancerous at all. I can't say at all, but still non-cancerous tumors which arise from the uterine muscle cells. Okay. So they are also called leiomyoma or just myoma, and more commonly benign. Yes.
Okay, doctor. I want to know around what age women are prone to uterine fibroids?
Uterine fibroids are more commonly diagnosed in 30s and 40s. Okay. But fibroids can be seen as early as just after menarche or up to menopause.
Up to menopause, from menarche to menopause. That is a
reproductive age group.
Yes. So it means that fibroids are found in the reproductive age of a woman.
Yes.
In the lifestyle.
In about 40 to 80% of patients reaching 50 years, we do diagnose fibroids in various forms.
Is there a chance of fibroids after menopause?
Fibroids don't grow after menopause, because if you know the reason why a fibroid arises, fibroids are fed by our estrogen and progesterone, our female hormones. So that is the reason why it is more commonly seen during the reproductive age group when we are producing estrogen and progesterone. So after menopause, when we see that a fibroid or a uterine growth is coming up, that is when we suspect malignancy, cancer. Till menopause, fibroids grow, but they grow at a very slow rate. A fibroid grows only 0.5 to 1 centimeter in a year.
So very little growth.
Yes, it has a very slow growth. But when we see a fibroid growing very fast, suddenly in a year, 4-5 centimeters, that's a growth, especially in later age group, 45, 50 years, nearing menopause. That is when we again suspect a cancer.
Okay, doctor, that was very informative. Then what are the symptoms of uterine fibroids?
Well, uterine fibroids, the most common symptom any patient comes with is bleeding, of course, any abnormality in bleeding. That is, they might be having more bleeding during their period. The number of days of bleeding might remain the same, but they say that there is more bleeding during each day. Sometimes they have prolonged bleeding during the same cycle. They bleed for more than 7 days. Some patients come with not just heavy bleeding, but severe pain during periods. And also, some patients come with bleeding in between periods. Between 2 periods, they have intermenstrual, we call it intermenstrual spotting or bleeding. They come with that as well. And some patients have very frequent cycles, like before they might be having once in 30 days they are having periods. Slowly the frequency increases, as in the duration of the cycle decreases. Every 24 days they start bleeding, every 21 days they start bleeding, every 20 days they start bleeding. So the frequency of the cycle increases and they have more bleeding. All these are bleeding symptoms. But some patients come with just pressure symptoms. Like they come with increased frequency of micturition. They want to go to the washroom every now and then. Though they are not passing much urine, the frequency increases. Some patients even come with retention, as in they are not able to pass urine. Complete blockage of the urinary tract because of the fibroid sitting there. These are the common symptoms. Though nowadays what we see is we have patients who come with unrelated symptoms. They might not be coming with menstrual symptoms at all. They might come to a surgeon or a physician with abdominal pain or some unrelated symptom for which they are undergoing an ultrasound. and incidentally they find a uterine fibroid and they come to us all worried. I have a tumor in my uterus, so what do I do next? So an asymptomatic fibroid is something that is more commonly seen nowadays because we have this intervention, ultrasound. We do ultrasound left, right, center for lots of other reasons, and we end up diagnosing a fibroid by that.
Oh. So symptoms will be present or may not be present
May not
also.
be present at all.
Okay.
Yes.
Once we find the symptoms, how can we diagnose this fibroids?
When they come with symptoms, definitely the first diagnostic modality is doing an ultrasound. So clinically, of course, we can, if the uterine fibroid is large enough for us to feel through the abdomen, some patients come with just a swelling in the abdomen. So they might not have too much of bleeding, but a swelling in the abdomen. So we suspect fibroid, then we send them for an ultrasound. That is when we actually diagnose fibroid. But then there are some patients where we have to go ahead with doing an MRI after an ultrasound, after diagnosing a fibroid, of course. But the MRI is most commonly done as a diagnostic modality when we are planning on a surgery. We are planning on a surgery with a patient with multiple big fibroids. We have to just remove the fibroids. We have to keep the uterus. When you are planning on a complicated surgery. Also, in patients who, like I said, when we are suspecting cancer, as in there is a rapid growth in the fibroid for some reason, or postmenopausal patient coming with a huge fibroid. So that is when we suspect cancer. That is also when we might also do an MRI.
Okay. So once diagnosed, what are the treatment measures you adopt? Will it go away with medicines, or usually we need surgical intervention?
Yes. See, medicines are effective in some fibroids. The thing is, it is not a cure. Medicines are just intermediary. As in, we are imagine we are planning on a surgery for a patient, but the patient was having so much of bleeding that she is anemic. We need to correct her anemia before we plan on a surgery. So that intermittent period, we might end up giving them medications. That is, there are medicines which actually shrink fibroids, medicines and injectables, injections as in we call them ulipristal, we have ulipristal, mifepristone tablets. Also we have GnRH analog injections which can be given during that intermittent period just to keep the symptoms at bay so that we can plan a surgery later on. They don't cure fibroids. And another place where we use medicines is when the fibroids are very small, we don't need a surgical intervention, and because of the fibroids, the only symptom is the patient is bleeding a lot. So just to decrease the bleeding so that the patient doesn't end up being anemic and not able to do their daily routine activities, that is when we give them tablets like tranexamic acid, mefenamic acid, which keep the bleeding at bay, and also the symptoms of dysmenorrhea, pain during menstruation, they keep them at bay. And patients will be able to go forward with a normal life just by taking those tablets only during periods. So the rest of the days they are pill free as well. They can continue taking it every month just during periods so that they don't bleed a lot. So we keep the symptoms at bay. As I said, the fibroids don't grow very fast. So maybe after a year or 5 years maybe they might end up having a surgery later on because of the slow growth of fibroid. But for the time being, or at least for a year or two, they would be able to we would be able to manage them with just the medicines. Also, we also use contraceptive pills. Again, the only intent there is to keep the bleeding at bay so that they don't bleed and become anemic.
That is not a temporary relief.
It is all temporary. All medications are temporary. Be it medicines given for bleeding to prevent not prevent, as in decrease the amount of bleeding, and also be it medicines which are used to shrink the fibroid for the time being, but they cannot be used for a long term because of their own side effects. The tablets have side effects which on prolonged use won't be suitable for the patient. Yes.
What are the common surgical methods you adopt?
Yes, once medical management fails, like we are not able to keep the bleeding at bay even with these tablets, when the fibroids reach a huge size, and in some patients who are planning on pregnancy, so they might have been diagnosed with a fibroid just after they got married or before that because of some other reason they went for a checkup. Those patients need need the uterus there. They want to have a baby, so retain the uterus. So we do a uterine preserving surgery, which is myomectomy. Myomectomy, we remove just the fibroids. It may be single fibroids, maybe multiple fibroids, but we can go ahead and do it. And myomectomy also, there are the fibroids are the type of tumor of the location of the tumor actually. Fibroids can be submucosal, as in they can grow into the uterine cavity, or they can be on the outside, subserosal fibroids, or it can be within the uterine wall itself, intramural fibroids. So depending upon the position of the fibroid also, we choose the treatment, the surgical modality. If it's inside the uterine cavity, we can go ahead do a minimally invasive procedure called a hysteroscopic myomectomy, where we go from below into the uterine cavity, take out the fibroid in piecemeal actually. We can't take out the whole fibroid as such. We call it morcellation. We take out the fibroid in pieces, and that is one treatment modality. The second one is, of course, the second minimally invasive procedure that we do is laparoscopic myomectomy. We go in with cameras and remove the myoma. We again, the fibroid might be big, like 5 or 6 centimeters. What we do is we morcellate it. We remove it out in pieces through that 1 centimeter hole. That, yes, laparoscopic. Then of course, there are some situations where we have to go ahead with an open myomectomy. Then we open the abdominal cavity and go ahead and just remove the fibroids.
Can you explain one such situation we do open surgery?
Open surgeries usually, one thing is the access for laparoscopy when it's not very good. When they're very huge, the fibroids are very huge, or there are so many multiple fibroids that we might not be able to achieve good hemostasis, good blood as in bleeding control during laparoscopy. Those are situations when we might end up thinking, okay, we'll do an open myomectomy and close up the patient. That's it.
Okay. Doctor, any risks associated with risk factors associated with such surgery? Normally?
Myomectomies always have the risk of bleeding because the uterine fibroid is arising from the myoma, the wall of the uterus itself, and hence the blood flow to the fibroid is through the uterine vessels itself. And when we try to remove a myoma, the blood loss during the removal might be so bad that we might end up doing a hysterectomy. We might have to save the patient's life by removing the uterus itself. So
Okay.
that is one thing that we have to be always, we always discuss that with the patient before we go ahead and do a myomectomy. That is always there.
Then doctor, is there a chance of this tumors growing malignant?
Yes, yes. Like I told you, it is we suspect malignancy only when they grow very fast or when they are seen in suddenly post-menopausal women. After menopause, when we see a fibroid which is growing, of course we think of malignancy. But the chances are very low, 1 to 2 in 1,000 of diagnosed fibroids maybe. That's all that is there. And
Very minor chance only.
yes, yes, very rare chance of fibroids turning malignant.
Then doctor, there's a common doubt that fibroids will cause infertility in women.
Fibroids do cause infertility, but after we say that a fibroid is causing infertility only after ruling out all the other causes of infertility. Because fibroids to cause infertility, there are certain conditions, like I said, submucosal fibroids which are bulging into the uterine cavity. They can cause recurrent abortions because the implantation might happen on the fibroid instead of the good endometrium, and that might not stay and it might get aborted. Similarly, if there are multiple fibroids distorting the uterine cavity, again preterm labor or abortions can happen. Also, if there are so many fibroids and in such a position that it is kinking the fallopian tube. Fallopian tube is through which we conceive, and then the embryo is implanted into the uterine cavity. So if the fallopian tube is kinked, both the fallopian tubes, that's again a catch. That is something that is very rarely seen. So those are the only conditions I feel that it can end up with the infertility per se. Fibroid per se becoming a reason for infertility is only in those conditions.
Very rare case.
Very rare, yes.
Okay. Then I have heard that fibroids once removed, there is always a tendency of them coming back. Is it so?
See, fibroids are tumors that arise from the myometrial cells. So each fibroid is just one cell that keeps multiplying. Okay. So we remove one myoma, the other the myometrial cells within our body still have the propensity or tendency to form new fibroids, right? So we remove whatever is seen, whatever we can palpate, touch and feel, or what can be seen, maybe up to 1 centimeter we can remove. But what about those sub-centimetric fibroids which are left behind?
Oh, yeah.
They start growing.
They may grow.
Yes, but they grow slowly again.
Okay.
We remove the big ones, the smaller ones which are there, which couldn't be seen by us when we were doing the surgery, they slowly grow. It is not the myoma that was removed which grows back.
Okay.
It is
Another
new,
one may grow.
It is new fibroids, because our body, if a person has the tendency to form fibroids, that means all the cells in her uterus have the tendency to form myomas. So even if one is removed, a new one can sprout.
Very nice information. Doctor, any takeaway message to our viewers from you?
There are a few instances when we felt maybe this patient could have come to us a little earlier. So any woman, I always tell them after 30 years, get a woman checkup, well woman checkup, so that we can diagnose them early. They might be bleeding, okay, because of all the family pressure and everything, work, taking care of kids. They tend to ignore the fact that they are bleeding heavily every month. They might be bleeding heavily and becoming anemic. They reach such an extent that there are patients who come with 5 grams, 6 grams hemoglobin, and then we diagnose them with fibroids. So timely checkup would have prevented them from having to undergo blood transfusions and then later on a surgery. That is one thing. Second thing is, every time an incidental asymptomatic fibroid is seen, don't get scared. Fibroids are mostly benign tumors. They don't become malignant until the conditions I said already. So don't insist on removing a fibroid. You are undergoing a surgery there. So you don't have to do that unless your condition, your medical condition is not being kept at bay with just tablets. And small fibroids don't do any harm. 2 centimeter, 3 centimeter fibroids can be managed with medicines during the periods. Just during the periods they need to take tablets, and they'll remain fine for a very long time, maybe 3, 4, 5 years. So don't get scared just by seeing an incidental asymptomatic fibroid in an ultrasound. So these are two things which we get worried about. Then they ladies come and tell us, no, somehow remove the tumor because I'm scared that there is tumor there, and what if it turns malignant?
Doctor, one last question. Any underlying causes for the fibroid, like heredity or something?
It is seen that fibroids do run in families, like mothers, sisters having fibroids. The girl who come to us also may end up having a fibroid. More than that, more than a genetic thing, it is ladies who have less number of children that have fibroids. So it is like it is said that fibroid is the baby of an unborn womb. You don't have babies, the uterus produces fibroids. It's basically more because estrogen and progesterone is continuously there in a patient who don't have babies, while they are kept at bay, there is no ovulation happening for a long time when they are pregnant for multiple times, and during pregnancy and lactation the hormone levels go down, as in we are not ovulating, and hence maybe it is protecting the uterus from producing fibroids.
Thank you, Doctor. Thank you for being with us in your busy schedule and giving us a lot of valuable information. Thank you once again.
Thank you so much. Thank you for having me here.
So viewers, I hope this was very informative and useful for you. To view more informative episodes, tune into Al-Hilal Health World every Tuesday at 8 p.m. Bahrain time. Till then, this is Jasila Mujib signing off. Stay healthy and happy always. Thank you.